Hi again, everybody. I'm Carla Macias along here with Jim Knox, and welcome to another episode of the Best Docs Network featuring Forest Park Medical Center right here in San Antonio, your destination to better health.
Exactly right, Carla. From staff to surgeons to technology and techniques, Forest Park Medical Center San Antonio is the place. And we'll kick off the show with our first Forest Park Medical Center doctor, urologist Dr. LeRoy Jones.
Initially, what began to happen is I was experiencing ED, erectile dysfunction. It was at the point that I couldn't maintain an erection, and we spent 5 years literally researching, trying to find an answer. After we found on the internet that the symptoms that I was having was related to Peyronie's, I finally saw a urologist who said that he was not an expert in ED, but he recommended that I call someone by the name of Dr. Jones.
Well, when a patient first presents with Peyronie's, we actually like to see him right away. I mean, typically what happens is that the guy will notice some curvature or his partner, and they're not really sure what's going on. And so we'll start out typically with oral therapy, and then depending on how the patient is doing, we may continue with that. If it's progressing or getting worse, then we'll do what's called intralesional therapy, and that's actually injection therapy. And then if that's not effective, then there's surgery, and there's some corrective surgery to straighten it out. And then lastly, penile prosthesis. So a lot of it just really depends on how bad the curvature is and when the patient gets to us.
So Dr. Jones confirmed my situation, and what was so encouraging, he says, the problem that you have, you're not going to be able to fix yourself. But he says, I have a solution, and that solution was a penile implant.
He had his implant, and he did very well with it. So he's not from San Antonio. Drove in, had a surgery, still outpatient operation, stayed in a hotel, saw him back the next day, and went home, and he came back in 6 weeks, and we taught him how to use it, and with our staff, and it's changed his life. I mean, it's a different person, and the thing about implants is that most guys that get them, they always regret waiting.
After I had the procedure done, the results were really far exceeded any expectation that I have. So now my wife and I still have the emotional tie. Now we have that physical part of our life back that we enjoy.
Don't forget, for more information about Forest Park Medical Center San Antonio, your destination to better health, head to the website, bestdocsnetwork.com, and click on that Forest Park Medical Center tab. Forest Park Medical Center, your destination to better health. Now to our next Forest Park Medical Center doctor. It's Dr. Bob Peters, who helped one young girl hear for the first time.
Well, we are from Bolivia. I came 2.5 years ago. My father and my mother, they started to seeing something strange with my baby girl.
I think the very first time that I noticed, and I was the one that really noticed it, there may be an issue, was when I first held her in Bolivia. She was just a few weeks old. I just noted that she didn't appear to be responding to noise and sounds around.
I was thinking that she was okay, that nothing was wrong, that maybe she's distracting, I don't know. When they told us that she wasn't listening, it was hard because I want she can listen to me or she can listen herself. So sometimes it's frustrating that you talk to the baby or you want to teach her something and you can't because she cannot listen.
Well, we first contacted Dr. Peters in Dallas Hearing Institute. Then we knew that he was the president of the foundation, of Dallas Hearing Foundation. And we talked to him, and they started looking for a device for Mia. And I'm glad that they found the right one. And hopefully, and it got help, that's gonna work good. It's gonna work good.
Med-El, along with the Dallas Hearing Foundation, we share a commitment to the hearing loss community. And when the Dallas Hearing Foundation approached Med-El, we thought this was an ideal situation to kind of help out a family. And so we put them into our grant process. And as the patient goes through the grant process, Mia and her family were approved.
Mia was born with profound hearing loss, and that means that hearing aids were not able to give her enough hearing. So the only way she would gain adequate hearing in order to develop speech and language, oral language, would be to have a cochlear implant. So today we placed a surgical implant that is meant to stimulate the hearing nerves that are there but just not working, and it will stimulate those nerves and produce for her a sense of hearing. We test the implant and determine during surgery that she is responding to the implant. We actually do not turn it on for 3 weeks. We want to let her incision heal. So we won't turn it on for 3 weeks. So she's just going to have, like any typical ear surgery, have some recovery time and some discomfort. But 3 weeks from now is when we'll bring them back to our office and actually activate the implant.
Wow, for her it's going to be a big difference. From not hearing to hearing is a big change. She was living happy without hearing, and now hearing she's going to be happier. That's why we're here. That's why we're in America, in Dallas, in this big hospital, good hospital, and with the best devices that she can get.
Thank you, Dallas Hearing Center. Thank you, Forest Park Medical Center. Thank you, Dr. Peters. Thank you, Linda, Debbie, all of them.
Did you know that in 2011, Forest Park Medical Center was voted as one of the top 20 most beautiful hospitals in the United States? Also, Forest Park Medical Centers were the only hospital in Texas to make this prestigious list. Stay tuned for Mia's inspirational stories conclusion coming up a little bit later on in the show.
One of the priorities that we have as an office, as family physicians, is to associate ourselves with the best hospital delivery systems in the city. And I feel, and my organization feel, that Forest Park represents that for the city of San Antonio.
This is the opportunity to give patients the exact care I'd want for myself, for my wife, for my children, and do it in a setting that they will find charming, relaxing, and restful, which we can't always say about trips to the hospital.
I was very excited to be approached by Forest Park to be part of this organization because they really care about quality. They really care about getting the best possible people involved so that they appreciate a proper assessment of patients so that they can do the right job in that OR suite. Their nurse to physician ratio for those patients who are in the hospital, phenomenal. No other institution has anything like that. I'm really looking forward to working with them here in San Antonio because this is premier medicine at its best, where you can really do what's in the best interest of the patient without interference from outside sources.
I think the idea of having a hospital run by doctors is a good one. I think that you commonly hear complaints by doctors that the rules are made by people who don't understand what happens in a hospital or what happens with caring for patients. And I think that with this model, you're going to have physicians who are able to help fix those kinds of problems. And I think it's going to make not only for a better patient experience, but for better patient safety.
So it's an honor for me to associate my organization to Forest Park organization because I believe that in San Antonio, in the hospital system, with the name and the quality of what Forest Park is creating, is needed for our patients. And to be successful, primary care physicians have to partner with the best hospitals in town. And Forest Park, in my opinion, going to be one of those organizations.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
For more information, please log on to our website, bestdocsnetwork.com, and click on that Forest Park Medical Center tab. Now on to our next doctor, Dr. Kathleen Hands, who's going to tell us a little bit more about thyroid testing.
Everything kind of started when I felt a squishy lump underneath my jaw, and I was referred to an ear, nose, and throat specialist. There was no reason at all to go to a doctor for that, and in the end, it turned out to be a stage 4 cancer. So I've been carrying that for about 30 years without knowing.
Approximately January 2011, genetic testing had been developed so that these patients could actually get genetic tests on those nodules that is performed at the time of the actual biopsy. But if you're BRAF positive, those patients aren't typically sensitive to radioactive iodine, and it's not going to work in those individuals. So having that information prior to their surgery so they get the appropriate surgery, having that information prospectively so we know after surgery how are we going to treat those patients is vitally important.
One of the most important things that a BRAF positive person can do is get a very, very good surgeon to take out as much of the cancer as possible. That was why it was so vital for me to have a surgeon who was extremely capable and experienced, and that's what they did. They took out all of my thyroid and 66 lymph nodes. From the very beginning, when we walked in, till our relationship today, it's always been one of tremendous amount of compassion. All the little details that me, just as a person, would want, that's the kind of doctor that she's been for me. Just giving me the confidence and the care that I think she would give a family member is all I can, compare it to.
First, do no harm. We really want to get patients to get the right treatment, which can now be tailored to their specific genetics. We've never been able to do that before. In the last 2 years, that's been a very groundbreaking procedure for thyroid cancer.
For more information on Forest Park Medical Center San Antonio, log on to our website, bestdocsnetwork.com, and click on that Forest Park Medical Center tab, your destination to a better health.
Exactly right, Carla. Now time to move on to our next Forest Park Medical Center San Antonio doctor. It's urologist Dr. Christopher Cantrill.
I had been experiencing an unremitting series of bladder infections for almost a year, and I was feeling really uncomfortable and was not responding to the medications that were being offered to me by an OBGYN, and I was feeling really frustrated. And finally, it was suggested that I go see a urologist.
When she first came to see me, she was having a lot of problems with what she thought was recurrent urinary tract infection. They were finding blood in her urine. She was having to go to the bathroom quite frequently and having pain with urination. And given that she'd had so many problems, we end up starting to look for more other reasons as to why people are having these infections. And in the clinic, I was able to look inside of her bladder, and I saw a small tumor growing inside of her bladder, or at least a mass that appeared to be like a bladder cancer.
He told me what was going to happen, and we tried a procedure and thought it had worked, and actually I had to go back a second time.
Unfortunately for Carol, we looked back in 3 months later and her tumor had recurred, which confirmed my concerns that this tumor was coming from the tube draining her kidney.
He checked again at several months later and wasn't totally happy and decided he wanted to do some reconstruction work. And I was glad. If we were going to do it, I wanted it to be right.
Whenever we're doing surgery for for cancers like Carol's of the ureter, the goal for us is to try and save as much of her kidney as we possibly can. Well, her tumor was isolated just in the lower portion of her ureter, and I felt fairly confident if we would be able to just take that portion of the drainage tube out, I could save her the rest of her kidney and take her ureter and reimplant that into the bladder to allow her to keep her kidney.
When he did the reconstruction of the bladder, he was able to preserve the bladder enough of a percentage of it that I am fine, and I am very grateful for that, very grateful.
At Forest Park, we call it the 6 senses of Forest Park, and you have your conventional 5, you know, and it talks about the experience that you get from the minute that you come onto our campus. So we're really kind of playing into those senses. So what are you seeing when you first get on the campus and walk into our hospitals? You know, are you looking at, you know, just great architecture? Are you looking at a brighter environment, you know, with natural sunlight and things of that nature? The art program is something that plays into the healing aspect, the visual aspect. So you'll see sculpture, you'll see original pieces, you'll see prints, you'll see a little bit of everything. And the way that we attack art is you should feel a little bit uncomfortable with art, you know, because if every piece of art in our facilities was something that you absolutely loved, then you probably didn't reach the entire community, because we all have different tastes, different aspects of what we like. What are you smelling? We have engineered scents in all of our hospitals, to where it's an engineering system called ScentStream, and it's built into our HVAC, and the scent that Forest Park has chosen is called Clean Sheets. But other things that you have just kind of coming into our environment is, you know, what type of food are you having, the taste. You know, we don't have cafeterias, we have dining facilities. What are you hearing when you come onto our campus and into our facility as well? Oftentimes in every facility that we do, we have water features, both outdoor water features and interior water features. So it provides a calming type sound that resonates throughout our facilities. What are the things that you're feeling? We have a lot of textural elements associated with our design. When you're coming in, the textural walls, whether it's the stone-cut exterior of a lot of our facilities, or when you're coming inside and you're feeling the texture of the fabric itself. You know, we really try to play into all of those senses for our patients. So, you know, whether it's in the lobby or it's in the patient rooms, or, you know, the thread count on the sheets, you know, those are the type of textural elements that really you may not instinctively know about those, but when you actually touch it and feel it, it'll make a difference to you. Every one of our facilities is a minimum of LEED Silver. So what that means is it's our environmental impact to the community as well. So we have rooftop gardens, where you have lush gardens that can be seen from all of our patient rooms. You're seeing planting, you're seeing stone, you're seeing in some cases water features associated with even our green roofs. But it's something that really kind of plays into the 6th sense of Forest Park, which is heal. And having a patient room that looks down onto grasses and trees and plants, and you know, it intrinsically has a healing aspect that really our patients have grown to appreciate. Again, we're playing to each of those senses, and then our 6th sense is heal, because at the end of the day, that's why we're here. We're here for the community, we're healing patients, and providing a place for our physicians to practice medicine. Walking onto our campuses, from step 1, what we really kind of focus on is that entire experience. It should look and feel not like a hospital, but it should look more like a hotel. You're really seeing something different. It has a completely different feel from anything else that you've seen in the market. You know, our job as developers and as Forest Park Medical Center is to deliver a facility that's different than what the physicians are used to, what the patients are used to.
Now for the conclusion of the inspirational story of a little girl named Mia, who Forest Park Medical Center Dr. Bob Peters helped her hear for the first time.
Not long ago at Forest Park Medical Center, Mia had surgery to help her hear. Now let's watch Mia hear for the very first time.
Well, today Mia is gonna get her cochlear implant, the activation, and she will start hearing. She will start hearing today, and we're very happy about it.
We were shaken and too excited for everything today. I know it wasn't like a huge thing, but for her it was something different.
Now the device is attached, and within a few moments you see responses from Mia that you've never seen. You know, you can tell something new is happening. She would have never been able to hear, and now she can and will. It's overwhelming. It's overwhelming.
She was happy, jumping and running, and it looked like she doesn't have anything there.
And we were so excited and so worried about her for not dropping the device. But she will do it, and we know. So we just want the best for her.
It has been a journey, and a long and a short one at the same time. Waiting, praying, wishing, and some days losing the hope.
Yeah. It's an amazing journey, and now it's just begun.
It's going to take some time for her to start to process. It's all about the brain processing information. It's going to take her time to realize, oh, that was the door knock, that was the doorbell, that's mommy's phone, that's mommy's voice, that's daddy's voice. It's going to all take time, just like a normal hearing infant. A normal hearing infant is born hearing perfectly, but they don't understand. Maybe 6 months, maybe 8 months, they start to respond to their name. They might start to respond to the dog's name. So she has to go through the same developmental stages of hearing and learning to talk that a normal child goes through. And that takes months and years.
It's gonna be a real challenge for us, but we are going to practice and we are going to help her and teach her.
There is no way to say thank you enough. There's no way to repay it other than we will be your ambassador, I can tell you that, and we'll try to make the best out of it for Mia and watch her develop, and we're just so thankful.
Everyone is changing her life. It's a new beginning for her. It's like a newborn, but now she can really start to listen and changing that part in her life.
Did you know at Forest Park Medical Center, the patient ratio of care is typically 4-to-1, one nurse to every 4 patients, versus the typical 5-to-1 or 6-to-1, which is characteristic in most hospitals.
I think what makes Forest Park unique and different is truly the culture that we have. A lot of places present that they have the patient care and the employee satisfaction in their culture, but when you walk into Forest Park, you feel the difference. Our directors over our units are very passionate about what we do, and since we're a physician-owned facility, the physicians that are here are very involved in the care and in the decisions that we make down to the inpatient level.
One thing I really love about Forest Park, and I tell everyone that I talk with in my nursing career about Forest Park, I like to talk about the camaraderie that's here. I really enjoy just a positive, energetic setting with the staff. Everyone works quite well together. Inter-department, just, you know, pharmacy, ER, X-ray, the doctors, the nurses. It's just a really cohesive unit, and I really enjoy that. And I feel like every day I come here, I enjoy my day. And that says a lot because nursing can be really stressful. So to be able to come here and feel the support from my teammates and to have a good day at the end of every day is something I really appreciate.
The best thing about working at Forest Park is that we are a family here. All the directors know each other. We know each other inside and outside of the hospital. We know how to work well with each other. And our administration here at Forest Park really appreciates and shows us how much they appreciate us, not in big ways, but in small ways every day that really make the difference in a place where you want to work.
One thing that really stood out about Forest Park was just the quality of patient care and just the way that the patients are treated, the entire, not only high level of patient care that's delivered, but also the entire experience that they receive here. The facility promotes patient satisfaction, patient care, which are all things that are very important to me, and it's a facility that I feel like I'm very in line with their values and what they view.
Unless you've worked at a hospital like Forest Park, you're going to find that there's a lot to learn, a lot to do, and a lot of rewarding experiences to be had here.
Stacy has a question for Dr. Ramon Reyes. How do I lose and maintain my weight?
What I always tell patients is to be patient with themselves. That the weight that they have in their body today didn't come there in a month or two. So it cannot come out of their body in a month or two. And it requires a commitment to change the way they're living. And what we do in this office is we help the patients with changing the way they're relating to food and changing the way they exercise. So we have nutritionists that are here in this office that are helping the patient on exactly what to eat, what to choose, what food to buy, how to cook the food, what snacks to eat, where to have those snacks. What not to have, how to eat properly when they go to restaurants, what food to choose when they go to restaurants. And if we can manage the weight on these patients, we can help them reduce some of the chronic diseases.
Each Forest Park facility is very unique. There are currently 3 facilities open in Texas. The largest facility is in Dallas. The second facility was opened in Frisco, which is in the North Dallas area, and the third one in Southlake, which is near the DFW airport. Each facility is unique and different, and a lot of that is because of the makeup of the physicians that are participating with Forest Park in each community. The mix of physicians is unique, the services provided is unique. It's tailored to the needs of the physician and medical community in each city. Each facility is stunning. They look like 5-star hotels. They're beautiful. The physicians now have an opportunity to take their patients to a facility that focuses on quality care and quality outcomes for their patients in a beautiful setting.
Thank you so much for joining us on another episode of the Best Docs Network featuring Forest Park Medical Center in San Antonio, your destination to better health. For more information, please log on to our website, bestdocsnetwork.com, and click on that Forest Park Medical Center tab.
And the good news is, Carla, for the folks out there who have a question or comment for us, send us an email at info@bestdocsnetwork.com. That's info@bestdocsnetwork.com. So long, everyone. We will see you next week.